I'll be talking to you briefly about exercise prescription for people diagnosed with multiple sclerosis. Specifically, I will focus on the cognitive and physical benefits that moderate intensity exercise can generate in the earliest stages of MS. I will also discuss the risk factors associated with exercising MS patients and techniques for obtaining maximal benefits whilst minimizing risk. Multiple sclerosis is an autoimmune degenerative disease that attacks the central nervous system. Nerve fibers in the central nervous system are insulated in a fatty tissue known as myelin. This insulation facilitates the propagation of action potentials along the nerve. In a person with MS, however, the myelin is lost in many areas, causing scar tissue known as sclerosis. This damage to the myelin decreases the capability of nerves to send messages to and from the brain. The symptoms of MS include fatigue, motor weakness, reduced mobility, and poor balance. These symptoms decrease the physical and cognitive functional capacity of the individual and tend to result in a sedentary lifestyle. Cognitive impairment is highly prevalent in persons with MS, with over 50% of patients experiencing cognitive dysfunction. This has been correlated with social isolation, unemployment, and a compromised quality of life. The treatment of MS is therapeutically confined to symptom management, with no pharmaceutical cure as yet known. As such, the focus of healthcare providers is to maintain and improve the quality of life for patients to the greatest extent possible. Contemporary research into symptom management indicates a direct correlation exists between a patient's exercise capacity and level of cognition, and has also shown a marked decline in feelings of fatigue and depression after a patient-specific aerobic exercise intervention. The gold standard measure of cardiorespiratory exercise is peak oxygen capacity, known as VO2 max. Research of MS patients has shown that endurance training at light to moderate intensities 3 times per week has led to a marked increase in the VO2 max of those patients. Furthermore, patients with mild MS showed an increase in cognitive processing speeds after the intervention, indicating that in clients with mild to moderate MS, the progression of symptoms can be slowed through an exercise intervention. Low-impact exercises are recommended for patients with MS. Activities such as yoga, walking, swimming, aqua aerobics, and Tai Chi are all considered beneficial and low risk for patients. Trouble balancing is a major consideration when exercising MS patients. Exercising within reach of a grab bar or rail will assist. MS patients have a tendency to overheat very rapidly when exercising. Water-based activities serve not only to keep the patient cool, but will also assist with balance. Through risk management strategies, MS patients can mitigate unnecessary risks when exercising, such as not working out during the hottest part of the day, staying well hydrated, exercising in a safe environment with low-impact movements, and not overexerting themselves. With the adequate procedures in place and the implementation of a progressive exercise program, an increase in exercise capacity can be expected. The research shows the benefits of exercise prescription for MS patients across the spectrum. However, the results tend to indicate the most potential for improvements in cognitive processing speeds occur amongst persons with mild MS. This would indicate that the level of disability is the moderator in the association between exercise capacity and improvements in cognitive processing speeds. Early intervention is therefore essential to ensure the maximal benefit to the client and maintain their quality of life. The benefits of moderate intensity exercise are well established throughout contemporary research. The increase of exercise capacity and a progression away from a sedentary lifestyle has not only primary but secondary health benefits for MS patients. Whilst exercise will not be the silver bullet that MS patients seek, it can lead to a better quality of life while slowing the progression of symptoms, specifically in the earlier stages of MS. I think we would all agree that any reduction in the severity of symptoms and any advancements in maintaining the quality of life for patients can be considered as significant when dealing with a debilitating degenerative disease such as MS. Thank you for listening.
Created using Powtoon.